Your doctor is addressing your heart, your brain, and your blood sugar as three separate problems. But they're not. And here's what changes everything. The same upstream dysfunction causing your high blood pressure is also fogging your brain and speeding up how fast you age. Millions of adults over 60 are dealing with this right now without knowing it. Before I show you the specific mechanism that connects all three and a single intervention that addresses them together, you need to understand why your doctor probably hasn't explained this. It's not their fault. They're trained to address symptoms, not systems. But once you see how these pieces actually fit together, you'll understand why some people stay sharp and strong into their 90s, while others decline rapidly after 65. Think about it. When did your blood pressure start creeping up? Probably around the same time you couldn't remember names as quickly. Coincidence? The Sprint Mind study says no. Researchers tracked thousands of adults and found that people who lowered their systolic blood pressure to less than 120 cut their risk of mild cognitive impairment. Big time. And the main Sprint trial showed that same intensive blood pressure control reduced cardiovascular events by 25%. But here's what most people miss. It's not just the systolic number. Your diastolic blood pressure, that bottom number, matters too. When it drops too low while addressing the top number, you risk orthostatic hypotension. That's the dizzy feeling when you stand up too fast. Except in older adults, it increases fall risk and actually reduces blood flow to the brain. Here's what's happening. After 30, various body functions start declining gradually. But it's not random. There's a pattern. Your blood vessels have this delicate inner lining. Think of it like the non-stick coating on a pan. When inflammation, sugar, or high blood pressure damages that coating, it affects every organ that depends on blood flow, which is all of them. Your heart works harder because the vessels are stiffer. Your brain gets less oxygen because the tiny capillaries are compromised. Your muscles get fewer nutrients. See where I'm going with this? And research backs this up. High blood pressure in your 40s to early 60s, that midlife period, directly increases your risk of cognitive decline later. The NIH confirmed this through multiple studies. Not speculation anymore. Fact. Here's what caught me off guard. Most adults over 60 have at least one cardiovascular risk factor. The minority have zero risk factors. They're dealing with some combination of blood pressure over 130/80, cholesterol issues, blood sugar problems, or obesity. Now, stay with me because this matters. Each of these isn't a separate problem. They're all expressions of the same underlying dysfunction: chronic inflammation. Doctors can actually measure this with something called C-reactive protein, CRP for short, or even better, high-sensitivity C-reactive protein, HSCRP. When your HSCRP is above 3, you're in the high-risk zone. Between 1 and 3, moderate risk. Below 1 is where you want to be. This single blood test tells you more about your overall health trajectory than almost any other marker. Think of inflammation like rust forming inside your body. It damages the walls of your arteries. That's atherosclerosis. It interferes with how your brain cells communicate. That's cognitive decline. It makes your cells resist insulin. That's metabolic syndrome. It can even trigger irregular heartbeats like atrial fibrillation. Same rust, different parts. Research is crystal clear on this. Chronic inflammation is strongly linked to heart problems. But here's what most videos leave out. That same inflammation is why superagers' brains shrink at only 1.06% per year, while normal 80-year-olds lose 2.24% of brain volume annually. You following me? Because this next part changes how you should think about prevention. Ever wonder why some people seem to age all at once? Like they're fine at 65, then by 70 everything falls apart? It's because these systems don't fail independently. They cascade. When your blood pressure stays elevated, even just slightly, it triggers what researchers call endothelial dysfunction. Blood vessels lose their ability to dilate properly. Less blood to the brain means less oxygen, fewer nutrients, more cellular waste building up. Your brain responds by producing inflammatory markers like interleukin-6. Those inflammatory markers travel through your bloodstream and damage your heart tissue, sometimes leading to atrial fibrillation or left ventricular hypertrophy. It's exhausting just thinking about it, right? Your body's fighting a war on multiple fronts. But here's the thing, and this actually gives me hope. Because these systems are so interconnected, fixing one helps all of them. The SPRINT trial proved this definitively. When researchers got people's systolic below 120 and kept their diastolic blood pressure stable, it didn't just reduce cardiovascular events by 25% and death by 27%. It protected their brains too. Same intervention, multiple benefits. Research from the Lancet Commission shows that around 40% of dementia cases come from 12 modifiable risk factors. Modifiable. You can change them. High blood pressure, physical inactivity, obesity, diabetes, smoking, depression, and others. Fix these, and you've just cut your dementia risk significantly. Okay, so if inflammation is the rust, and it's affecting your heart, brain, and metabolism all at once, what's the rust remover? Movement. But not the way you think. The recommendation is 150 minutes of moderate exercise per week. That's 2.5 hours. But here's what they don't emphasize enough. It's not about burning calories or even building muscle, though those happen too. Exercise changes your biology at the cellular level. Mayo Clinic research shows that exercise reduces senescent cells, zombie cells that stop dividing but won't die. They just sit there pumping out inflammatory signals. One study found that high physical activity versus low activity creates a 34% reduction in dementia risk. Not a typo, 34%. But here's the thing that matters. It's not about intensity. It's about consistency. Those superagers with the slowly shrinking brains, they're not running marathons. They walk every day, dance, garden, swim. They move in ways they enjoy, so they keep doing it. The biochemistry is fascinating. When you exercise, your muscles release compounds called myokines. These act like anti-inflammatory drugs, but better. They improve insulin sensitivity, lower blood pressure, trigger production of BDNF, brain-derived neurotrophic factor, basically miracle grow for your brain cells. And diet? The DASH diet, dietary approaches to stop hypertension, was specifically designed for blood pressure. But guess what? People following the DASH diet also show better cognitive function and lower inflammation markers. Because again, it's all connected. One intervention benefits everywhere. Your doctor addresses the symptoms separately because that's how medical specialization works. But your body doesn't care about medical specialties. It responds as one system. So here's what this means in practice, the thing I've been building to. You don't need 3 different plans for your heart, brain, and longevity. You need one approach that targets the shared mechanism. Start with blood pressure. If your systolic is over 120, that's your priority. But watch that diastolic blood pressure too, especially if you're on medication. The SPRINT trial was clear. Getting below 120 reduces both cardiovascular events and cognitive decline. Talk to your doctor about whether you need ACE inhibitors or angiotensin receptor blockers. Don't guess with this. Get your inflammation checked. Ask for a high-sensitivity C-reactive protein test. If it's elevated, that's your early warning system firing. The good news? Exercise and the DASH diet both lower CRP levels naturally. Add consistent movement, not occasionally, daily. Even just reducing sitting time helps. Long periods of sitting mess with your blood sugar, cholesterol, and blood pressure all at once. Stand up every hour. Walk to get your mail. Take stairs when you can. But watch for orthostatic hypotension. If you get dizzy standing up, rise slowly and hold on to something stable. And here's something interesting. Quitting smoking might be the single most effective change, regardless of your age. Even if you've smoked for decades, benefits start immediately and compound over time. The point is this: genetics only account for 20 to 30% of your lifespan. The rest, that's the choices you make right now, today. Not perfect choices, just better ones, consistently. Look, one more thing. Actually, the most important thing. Everything I've shared today comes from published research. The SPRINT trial, established cardiovascular guidelines, NIH data. But it's educational information, not medical advice. Your situation is unique. You might be on medications that interact. You might have conditions I haven't mentioned. Maybe atrial fibrillation, orthostatic hypotension, or specific inflammatory conditions. Your doctor knows your full health picture, your medical history, your current medications, your specific risk factors. Use this as a starting point for that conversation, never as a replacement for it. Research is clear, though. Heart disease causes 1 in 3 deaths. But we also know that cardiovascular disease, cognitive decline, and accelerated aging share common upstream causes. Fix those causes. Control inflammation, lower blood pressure, move your body. And you're not just adding years to your life, you're adding life to your years. What surprised you most about these connections? Drop a comment below. I read every single one, and your questions help me know what to cover next.